married, take your wedding ring off. You got a watch on, take your watch
I
off.
have a connection with this for 20 years.
I understand. Do you want a 100 or do you not?
Yeah,
What's wrong with you? I told you about those eyebrows.
she wasn't.
Not you, Abby. I was talking about somebody in the back. I told you about what are you looking like that for? Do you object?
Non-verbal
Oh,
communication.
no, that's what you're saying. No.
Oh, I'm like, what's going on? Non-verbal communication back there, guys. Like, I look at everybody and I'm like, Okay? So main thing, guys, remove all jewelry. That's the first thing you should do. Go over there, put it in your pocket, put it on the counter, whatever you want to do. And then next thing, don't touch the sink, guys. When you come up to the sink, don't lean on the sink like this, leaning on it. Don't let the sink come in contact with you. It's all kind of germs. It's the restroom. All kind of germs on the sink. So do not lean against the sink. Do not allow clothing to touch the sink. Okay?
So whatever in here, that's how we're gonna do tomorrow.
This is exactly how I want you to do it tomorrow.
Okay.
That's why we're going through it. But these are the exact same instructions on table 12.5, okay? So turn on the tap, turn on the water, of course. You can turn it on by hand, or if you OCD, use your paper towel to cut the water on if you want to. Your hands are already dirty, so whatever. So make sure you get your water to a nice little warm temperature, however you like it. During the entire procedure, keep hands and forearms lower than your elbows, meaning that don't be washing your hand like this, because then all of the water is still gonna come down, to come down your arm. Okay. Wet hands, soak them well. Wash in a firm circular scrubbing motion. If you have a brush, use a brush. Okay. If they have to have like one of those scrubbing brushes, mind you, if scrubbing brushes come in plastic, so you don't share them. Nobody else is gonna use those scrubbing brushes. You looking like, what? Scrubbing brushes? Okay. So make sure you wash the palm, back of your hands, between the knuckles, fingers, and get under your nails. Make sure you get up under the nails, okay? Wash at least 1 inch above the wrist. Wash at least, I'll have to wash to my names on my arm. Wash at least 1 inch above the wrist, okay? That should happen. The paper says 15 seconds. I think it's changed for 20 seconds, but this says 15 seconds. That's what we're going with. That's what, do your ABCs twice, happy birthday song once. That should be at least 15 seconds. Got it. I'm gonna be making sure it's 15 seconds. All right. So rinse hands and fingers well under running water. Okay. Allow water to run over the hands. Make sure you get them all off. Don't just, guys, this is the #1 detriment to failing this test. Don't just turn the water off with your newly clean hands. Grab you a paper towel, turn your water off. Or, no, I'm sorry. First, grab your paper towel, or you can use your elbow, or that. But grab your paper towel, dry your hands off, and then turn your water off with that same paper towel. Okay? All right? Dry from elbow to fingertips. And that's it, guys. You follow these instructions right here, you're going to get a 100 on your hand washing, guys. Easy work. Easy work. Added it. I'm expecting 100 from you. 100 from everybody in here. So remember the key points.
Tomorrow, just maneuver.
Huh?
Tomorrow, just maneuver. No communications.
No communication. Just wash your hands. I'm just going to wait and be like, okay, you wash them well. You wash them well. That's all I want you to do. That's it. Wash your hands. Wash your hands. Follow those instructions, you'll do well. Take your rings and stuff off, 15 seconds. Don't let the sink touch you. And lastly, don't turn the water off with your bare hands, please. Because your hands just as dirty as when you first started washing. All right? So, guys, let's talk about PPE. PPE, or personal protective equipment, is worn by healthcare professionals to protect them from exposure or contact with an infectious agent. Okay? This includes gowns, gloves, goggles, masks, if you happen to have goggles or masks, face shields. Some of these masks right here even come with a face shield. Like this right here. See, she got a face shield on her mask. See that? See that mask right there has a face shield on it right there? I know it's tough. I got the next picture coming up. Or my man is a hazmat, like he's gonna see an Ebola patient or something like that. Okay? And that also includes shoe covers and respirators. That N95, our N95 respirator right there. Okay? You should be fitted for this, an N95S. Make sure these things, when they fit you, make sure they're snug all the way around, okay? You don't want to be hanging off You know what I mean? Because then it's not doing anything to protect. Again, like I told you guys, these things leave a big mark. So when I wear them, it's hard to breathe, but I wear them like this because, like I said, I'm still working, baby. I gotta look good. I can't have them lines on my face all day. Come on now. Okay? The form chosen depends upon patient interaction, guys. So if there's no need to wear shoe covers, if there's no bodily fluids or anything like that, there's no need to wear it. So, you know, just be mindful of whatever exam you're doing, what kind of PPE you're using. Okay? Wear a clean pair of gloves to perform an exam. That goes without saying, of course. Follow proper procedure for removing dirty gloves. I'm going to show you in 1 second, guys. Wash your hands after removing gloves. With an isolation patient, guys, remember I was talking about isolation patient or isolation precautions yesterday? Meaning that if you go upstairs to a unit, person has TB, C. diff, MRSA, those patients are going to be isolated. They're not going to be in the whole department unit with everybody else. They're going to have an isolated room that you're going to have to go into and perform that exam. Okay? With isolation patient, you may need to wear a mask, gown. Remember I said they're going to have those signs on the door that show you what kind of precaution this patient has. But remember, we're going to use universal or standard precautions on everybody because that's the minimum. Because we're going to treat everybody as if they're carrying an infectious disease. Okay? So that means gloving up every time. All right? So if body fluid splatter is possible, wear gloves, a gown, a mask, and eye protection. Okay? Gloving, guys. Our gloves. Always put on a pair of gloves before an exam even if the patient looks healthy. I know some people like you, guys, I'm saying this like it sounds like common sense, right? It really does. But when you start working, you'll see for people performing exams with no gloves at all day.
Right.
Some people might wash their hands 1 or 2 times all day. You're going to see it. You're going to see blood on the ground. Somebody grab a paper towel and just start wiping the blood off without putting the glove on their hand. I'm telling you, it's going to surprise you. So don't be surprised when you see it because I gave you the forewarning. Okay? Gloving is a fundamental step to prevent the spread of infection among you and your patients and your coworkers, guys. Everybody in the hospital. Latex gloves, guys, are almost obsolete. Nobody uses latex gloves anymore. If you've noticed, these gloves right here are nitro gloves. You know, they're like a synthetic rubber, you know, and that's what they use now because a lot of people are allergic to latex or have latex allergies or sensitivities to latex. So now, most facilities use nitro gloves. I don't know any facility. Pat, do you? We use nitro. Nobody use latex? You know anybody use latex? Yeah, I don't know anybody use latex anymore. Okay? So when we talk about gloves, guys, I'm going to demonstrate it because I want you to know what to do when you're in clinic. I'm going to just demonstrate how to take off the gloves, okay? Demonstrate how to take off the gloves. So, when you take out the glove, I know it's in, what's that? It's on table 12-6. Table 12-6 right there. It's really precise as how they're giving the explanation right there. But once your gloves are on, we already done the exam, you know? So remember, the inside of your gloves, they're not soiled, okay? They're not soiled. So when I take one glove off, I don't really care which glove you take off. I know the book is specific. I think it says take off the right hand, take off the glove right hand. Who cares? That's not really that important. Just take a glove off right there. What I always do, take my glove off one hand. I always kind of like hold one glove in my hand like this because I'm gonna make a little ball. Then you grab the inside of your glove with your index finger like this. Then you take the other one out. Then you take the other one off. But that's how you do it, Lauren. That's how you do it right there. So when you take the gloves, especially you want to do that, especially when they're soiled. Sometimes, Pat, tell me, are we supposed to do this? Sometimes when I wear two sets of gloves, you know, just so I can, even though it's really not clean, you know, I just wear two because sometimes when I'm working, I'll bust through one pair, you know, or something like that. So I always wear two gloves whenever I'm on board. But I don't know if that's you're not supposed to do that, right?
You should not.
Okay. Don't do that.
It seems convenient though.
Don't do that, guys. Wear one pair of gloves, all right? Okay. Some other forms of PPE, like say for instance, we're doing an invasive procedure like paracentesis or thoracentesis, amniocentesis, a biopsy, prostate biopsy, renal biopsy. You know, you're gonna have other forms of PPE, especially if there's a possibility of exposure to bodily fluids or splatter, okay? It is best to wear wear a mask and eye protection. Like this mask right here, everybody can see that mask right there. So if you happen to be, I don't know, doing a paracentesis or something,